Good morning and welcome to New South Wales Health's COVID-19 update for Friday, the 11th of June 2021. New South Wales recorded no new locally acquired cases of COVID-19 in the 24 hours to 8 o'clock last night. One overseas acquired case was recorded in the same period, bringing the total number of cases in New South Wales since the beginning of the pandemic to 5,422. 18,525 tests were reported to 8 o'clock last night, compared to the previous day's total of 19,810. New South Wales Health administered 15,623 COVID-19 vaccines in the 24 hours to 8 o'clock last night, including 5,382 at the vaccination centre at Sydney Olympic Park. The total number of vaccines administered in New South Wales is now 1,630,098. This includes 561,593 doses administered by New South Wales Health to 8 o'clock last night and 1,068,505 administered by the GP network and other providers to 11:59 p.m. on Wednesday, the 9th of June. New South Wales Health is treating 26 COVID-19 cases, none of whom are in intensive care. New South Wales Health was advised yesterday, Thursday the 10th of June, of further venues of concern after 2 confirmed cases of COVID-19 travelled through regional New South Wales while potentially infectious. These cases drove from Melbourne to the Sunshine Coast, stopping at places in Gillenbar, Forbes, Dubbo, Coonabarabran and Moree. Please check our website for a list of potential exposure sites, including and related health advice, regularly as these may be updated. If you attended any of these venues at the times listed, please get tested immediately and isolate until you receive further information from New South Wales Health. Our investigations into the movements of these cases in regional New South Wales has identified 355 contacts to date. Anyone who resides, works in or has just visited these areas since the 1st of June needs to be especially vigilant for the onset of even the mildest of cold-like symptoms. We urge you to come forward for testing immediately if symptoms appear and then isolate until you receive a negative result. New pop-up testing clinics in Dubbo, Forbes, Parkes, Coonabarabran are supporting increased testing for the communities living or working in these areas. We've also extended opening hours at existing clinics in Moree and Parkes. Please check our website for locations and opening hours. New South Wales Health was also notified on Wednesday that fragments of the virus that causes COVID-19 were detected in the Castle Hill sewage network. This is the second recent detection in the catchment following the first on Sunday, the 6th of June. This catchment includes about 8,400 people and takes sewage from the suburbs of Glenhaven, Dural, Kenthurst, Kellyville and Castle Hill. People who have recently recovered from COVID-19 can continue to shed virus fragments into the sewage system for several weeks, even after they are no longer infectious. New South Wales Health thanks the Castle Hill community for coming forward for testing and continues to ask people in these areas to be especially vigilant for monitoring for symptoms. There are over 300 testing locations in New South Wales. For advice where you can get tested, visit our website or contact your GP. Thanks very much.